On the topic of trauma, and I gotta ask, so we'll switch gears a little bit. So with TXA, obviously you've been giving forever. We have just got a directive for TXA. As far as I understand it, Orange is currently giving 2 grams of
Correct.
TXA for trauma. So we give a gram. Are you giving an additional when you get there? Is it valuable? What is going on here? Because I know people are going to ask.
Sure. So, yeah, we've been giving TXA for a few years now. As the early studies came out to suggest its benefit, we started providing TXA. Now, when we started, we were following the early guidelines, which suggested, giving a gram as a bolus and then another gram over 8 hours. So that's how we started providing TXA. But in the meantime, the province has come up with a provincial guideline for a massive hemorrhage protocol. And so when that was released, and this was only a couple of years ago, one of the suggestions made in those guidelines was that teams should give 2 grams of TXA upfront prior to transferring that patient to a trauma center. And so that guidance was provided to the community hospitals, and it was provided to the pre-hospital world, right? I think they were really focused on Orange at the time because we were the only ones giving TXA. But the thought was, the earlier you can give TXA, the better for the patient. So we have that sort of 3-hour window in which we should give the patient TXA. Past that point, there's really no benefit. But even further to that, the sooner you can give TXA, the better for the patient. And then the other piece of that was, we want to ensure they've received 2 grams, or an adult receives 2 grams of TXA. And so giving that 1 gram bolus up front and then this 1 gram over 8-hour infusion, the piece that was missing was that infusion wasn't being maintained, right? So we might start it in the field. When we get to the trauma center, they may or may not continue that infusion, or maybe just in the heat of the moment, it gets missed and that infusion is not continued. So one of the recommendations was that we give 2 grams up front. It is safe to do so. It ensures the patient gets what they need. And then when we arrive at the trauma center, that's done. And they received it within that 3-hour window, and hopefully as soon as possible. So I think it's great that it's now become a pre-hospital medication, because from time of injury till you're at a point in time where you can administer that medication should be within a half hour. That's proven to be the best benefit for the patient. Unfortunately, you're giving 1 gram, but you just have to make sure that's very clearly communicated to either the Orange paramedics or the hospital you're going to, so that they can give the 2nd gram. So if we show up on scene and you've already administered a gram, we will administer a 2nd gram. When you go to the local hospital, or if you go direct to a trauma center, your team needs to make it very clear that we only gave a gram, or given a gram of TXA, so that they can give the 2nd gram. That's important. So, yeah, the fact that you're giving a gram and not 2 grams, that's not a big deal. I'm glad that you're actually giving TXA, and maybe more evidence will come out in the future to support the pre-hospital teams giving 2 grams. So that's fine.
Yeah, I can speak to some of the background. That part of the reason why we got a gram was logistically, like if we were giving an intramuscular injection for TXA, which is one of our routes we could do, they didn't want us giving 20 mils throughout all the muscle groups. So that's part of the reason. And they knew, like Orange paramedics or the hospital could follow up with the subsequent 1 gram.
Yeah.
But could you speak to actually having such expertise and comfort with it? Have you seen it work well in the pre-hospital setting in your environment?
Well, it's not one of those medications that you get an immediate result, right? So it's sort of supporting clotting in the sense that it's not preventing the breakdown of clots that are formed. So we're not going to see the benefit of that in the time that we're with the patient. But when you look at the studies and the overall mortality and morbidity benefits, it works. And we also know that it's key to give it as soon as possible. So though we as paramedics are never going to see the immediate results from the TXA administration, we need to trust the evidence and know that what we're doing is greatly benefiting that patient long-term. So that combined with good resuscitation will improve that patient's outcome. There's no question. So yeah, it's what to do.
This podcast is for educational and informational purposes only. It is not medical advice, does not establish a standard of care, and must not be used to diagnose, treat, or manage any medical condition or emergency. The content discussed reflects general principles that may not apply to every situation, system, or patient. Clinical practice varies by region, service, and jurisdiction. Always follow your local medical directives, clinical guidelines, protocols, and the instruction of your medical oversight or base hospital physician.